BTL presents an innovative therapy, the superinductive system. The basis of the whole technology is the high-intensity electromagnetic field created in the applicator coil. Based on the frequency and intensity of this field, the device causes pain relief in the first place and also joint mobilization, bone fracture healing support, trigger muscle contractions, or achieves muscle relaxation. The analgesic effect is reached through affecting 3 different theories of pain. At lower frequencies in the range of 2 to 10 Hz, the superinductive system affects tissue through the endogenous opioid theory of pain. The gate control theory of pain is affected using frequencies of 60 to 100 Hz. 120 to 140 Hz frequencies suppresses pain through the coding theory. Due to the versatility of the BTL superinductive system, analgesia is the key effect and its main asset in the treatment of musculoskeletal and neurological disorders. Another medical effect caused by the BTL superinductive system is joint mobilization, which occurs due to repetitive muscle contractions in the articular capsule area. The contractions cause a slight shift of the joint surface against each other and as a result release the blockage and restore joint play. Muscle contractions are used in the strengthening of weakened muscles and muscle groups and in preventing muscle atrophy. The contractions are achieved by stimulating the neuromuscular tissue. The therapy is contactless and it's therefore easy to treat various body parts. The BTL superinductive system can also support the bone fracture healing process. Through action of the high-intensity magnetic field, neovascularization occurs in the area, and through that, new bone formation is supported. The superinductive system positively affects spasticity disorders. The therapy procedure then consists of reciprocal inhibition of the spastic muscle and facilitation of the antagonistic muscle, which leads to spasticity reduction. An electromagnetic field is targeted into a small spot right in the center of the coil in the focused applicator. It penetrates deep into the tissue, which allows for precise targeting of the therapy, which is particularly important in the treatment of neurological disorders and pain reduction. Examine the patient thoroughly to find the disorder and the location to be treated. Thanks to the variable 6-joint arm, the applicator is easily placed above any body part. Select the suitable preset protocol according to the defined disorder from the device encyclopedia and press Start. After starting the therapy, adjust the intensity to the recommended level using the knob on the device. Communicate with the patient while doing so in order to set the intensity precisely. From this point, the therapy runs without the need for the therapist's intervention. The treatment continues until the therapy time is up.